There are numerous clinical trials going on all around the United States and in fact all over the world for patients with hepatic steatosis and MASH. Some of the studies look at patients that have moderate to advanced liver disease. Some of the studies are looking at people with compensated cirrhosis, meaning they have cirrhosis. They may have the low platelet count, which we mentioned earlier, but they have otherwise no signs or symptoms of having advanced liver disease. There are studies all around the world. Now, they're usually at university centers or very high volume clinical practices in the United States. But if patients are interested in more than standard of care, state-of-the-art therapies, new therapies, highly promising therapies, if you're at a university center, then you know you have these studies. If you're not at a university center, but one is nearby, patients can be afforded an opportunity to go to those centers and determine if they're eligible to be in clinical studies. Because there are many, many promising agents that are under investigation for helping people with hepatic steatosis, MASH, and usually the studies involve people that have fibrosis. One of the most exciting advances in the field of hepatic steatosis and MASH is the first approval of a medication that occurred in the United States in March 2024. The generic name of the product is resmetirom. And studies showed that in people with MASH, steatohepatitis, that was biopsy proven, and stage 2 or 3 fibrosis, which is a moderate to advanced liver disease patient, but not cirrhosis, showed benefit. Patients showed, compared to placebo, statistical improvement both in the resolution of the steatohepatitis and even regression of fibrosis at 1 year after receiving resmetirom in comparison to placebo. So this was an exciting development because previously we only had lifestyle modification. And lifestyle modification is still important because it too is highly effective. But finally, for this one niche of patients with steatohepatitis and stage 2 or 3 fibrosis, we now have a medication that has been shown to be efficacious. Now, there are other emerging medications, and this gets into some clinical research on the topic of treatment that are also emerging. They're not approved yet. We suspect that they might be approved within the next year or two, this class, but it's the glucagon-like peptide 1 agonist, GLP-1. Now, this is a class of medication that's already been approved for treatment of type 2 diabetes mellitus. It has, in some cases, some of the products have been approved for treatment of obesity for weight loss, but it is not yet approved, this class, for fatty liver. And yet, there have been many studies ongoing with various different products, and they have shown very exciting preliminary data with resolution of steatohepatitis and improvement of fibrosis, similar to resmetirom. Now, we think those medications work by promoting weight loss, whereas the resmetirom is a liver-directed therapy. It actually works via a different mechanism. So there are new medications on the way for the afflicted patients with fatty liver, MASH, and hepatic fibrosis. I think one of the biggest problems in the field is the lack of recognition of hepatic steatosis and its impact on patients in the primary care community. It's one of those diseases that occurs in the setting of diabetes and hypertension and hyperlipidemia. There's a lot of focus by primary care on these other medical conditions, rightfully so. But I think hepatic steatosis in that patient population, which is in very high frequency, is overlooked. And Some patients, because only a fraction develop advanced liver disease, are disadvantaged. So I become very passionate in trying to educate primary care providers about fatty liver. Keep it in mind. Please remember that when you see patients with these other metabolic risk factors or who are overweight, that they could have fatty liver. And you should consider it. You should evaluate patients for it. Look for hepatic fibrosis. And in a fraction, you'll find it. And one other thing I think is underserved, and that is in patients that have cirrhosis, that feel well. Those patients are at risk for liver cancer, and you must not forget to have liver ultrasounds done for liver cancer screening every 6 months. For instance, hepatitis C patients that have cirrhosis that have been cured from their hepatitis C, and they feel great, these patients. They still have cirrhosis, though. They are at risk for liver cancer, and they need to be screened. And the same is true with steatosis patients. So please do not forget to screen these patients. It is the standard of care, and missing liver cancer actually has very grave consequences.